My name is JP. I'm a student physical therapist assistant from CBD College. My first patient is a 42-year-old who presents with right shoulder impairments and limitations following surgical repair on the right glenohumeral slap lesion. The patient is currently in the acute phase of rehabilitation because the patient just had surgery 5 days ago, which still falls under the inflammatory stage. The treatment goals in this phase is to mainly and maximally protect the healing tissue and to decrease pain and inflammation. Also to maintain range of motion and strength to prevent atrophy and complications and to promote functional mobility. Lastly, to provide education for self-care and home exercises program. Considering the doctor's orders, here are the 3 exercises the patient can safely do. Pendulum exercise. This will allow initiation of movements on the shoulder without excessive stress on the healing structures. You can ask the patient to do this 10 reps with 3 sets, twice a day, 3 times a week. To do this, grab onto the table and bend over, letting the affected arm hang, then initiate movements with the body to make the right arm swing in small circular motions. Shoulder shrugs. This will improve the patient's shoulder mobility through scapular mobilization without stressing the glenohumeral joint. You can tell the patient to gently bring both shoulders up and slowly bring it down. Do this for 10 reps, 3 sets, 2 times a day, 3 times a week. The third one is rotators isometrics. This is to prevent atrophy and to initiate strength without any joint movement. To do this, have the patient stand next to a wall, use a rolled towel in between the arm and the body. Then, instruct the patient to push the forearm against the wall for external rotation. Holding it for 10 seconds, repeat 10 times, 3 sets, twice a day. Repeat pushing to the other side for internal rotation. Typically, the patient is ready to move on to the next phase of rehabilitation of 5 weeks post-surgery when there are less movement restrictions. The patient will also be ready to progress exercises when there is decreased pain in motion, swelling and inflammation, and increased shoulder flexors, abductors, and rotator strength. My second patient is a 72-year-old who presents with left wrist pain and weakness after sustaining a distal radial fracture. To decrease these impairments, we could use a cold pack to slow down the circulation, which will decrease the inflammation and pain. We can also provide grade 1 joint mobilization to assist decreasing patient's pain. We will know the effectiveness of these interventions if the patient's subjective reports of pain are lesser and patient is less frustrated with their ADL. To increase the patient's wrist range of motion, we can tell them to stretch their wrist flexors so that there's improvement with their wrist extension. We will know if the patient is benefiting from this if we observe increase in range of motion and if patient reports improvement with functional motions. To improve patient strength, we can start off with wrist flexor and extensor strengthening by lifting lightweight dumbbells, and then we can gradually increase the weight as tolerated. We will know if the patient is benefiting from this treatment if there is an objective increased strength in the patient's wrist flexors and extensor MMT and improvement in the patient's ADL. Considering the patient is left-handed, that person may be limited in doing their activities of daily living, such as taking showers, typing, writing, eating, opening jars even. With these limitations, the patient may be experiencing restrictions like playing sports with friends, going to restaurants to eat, or even grocery shopping.